If you think your penis is just about pleasure or intimacy, think again. It's actually one of the first places in your body where real health problems quietly begin to show. What if I told you that long before a heart attack strikes, before diabetes takes hold, before your body breaks down, your penis tries to warn you? The truth is, for millions of men over 60, the first sign that something dangerous is happening isn't chest pain or fatigue. It's a softer erection. It's difficulty performing. It's a quiet change most men ignore, dismiss, or hide out of shame. But ignoring this signal can be deadly, because when blood stops flowing properly down there, it's often already slowing everywhere. And that means your most private problem could actually be your first warning sign of something much bigger. My name is Dr. Nora. I've spent over 2 decades working with men in their 50s, 60s, 70s, and beyond. Men who once believed that losing their erections was just part of aging. But what we discovered together shocked even me. In many cases, erectile dysfunction wasn't just a bedroom issue. It was the earliest red flag for heart disease, high blood pressure, blood vessel damage, low testosterone, and even the early signs of silent strokes. Today, I want to take you inside this hidden connection. How what happens to your penis can be a window into your heart, your brain, and your future. And more importantly, I'll show you exactly what you can do to take back control, reignite your health, and protect your life. Starting right now. Before we continue, if you're serious about staying strong, sharp, and confident after 60, hit that subscribe button and turn on notifications. Every week, I share science-backed strategies to keep your energy, your drive, and your body thriving, naturally. And if you've already experienced any change in your intimacy or strength, let me know in the comments with a 1. If you're not sure but want to learn, type 0. Your response helps me guide future advice designed just for you. Now let's begin with a truth most doctors still don't tell their patients. Erections are about blood flow. That's it. Not magic, not masculinity, not mystery. Blood flow. Your penis has no bones, no special muscles to become hard. It relies entirely on the ability of your blood vessels to open wide and let blood flood in. And if they can't, you lose your strength. You lose your function. And you lose one of your body's most honest warning systems. Because the blood vessels in your penis are tiny, much smaller than those leading to your heart or brain. So if blood flow is struggling, your penis feels it first. That's why doctors now recognize erectile dysfunction as an early indicator of atherosclerosis, the buildup of plaque inside your arteries. That same plaque that causes heart attacks, the same blockage that causes strokes. And it doesn't happen overnight. It builds silently for years. Men often come to me saying they feel fine, just a little less firm than before. But when we run the tests, we find clogged arteries, prediabetes, hormonal imbalances, and sometimes advanced cardiovascular disease they never knew they had. One man in particular, I'll never forget. He was 67, active, retired military, proud of his health. But he'd started having trouble in the bedroom. He thought maybe it was stress, maybe just getting older. His wife finally convinced him to talk to someone. After one look at his blood work and ultrasound scans, I sent him straight to a cardiologist. 3 weeks later, he had a triple bypass surgery that saved his life. All because he listened to what his penis was trying to say. Gentlemen, this isn't about embarrassment. It's about awareness. because ignoring this signal doesn't just rob you of your intimacy, it can cost you your life. So, let's talk about what happens as you age and why these changes are not random. In your 20s and 30s, your blood vessels are wide, flexible, and responsive. When you're excited, they open up quickly, sending blood exactly where it's needed. But after 40, and especially after 60, that flexibility starts to fade. Cholesterol builds up. Inflammation stiffens your arteries. Your nitric oxide levels, critical for blood vessel relaxation, drop by over 50%. Testosterone falls, stress rises, sleep suffers. All of these changes make it harder to get and keep an erection. But again, that's not just a bedroom problem. That's a full body warning sign. Think of your penis as the canary in the coal mine. When it stops singing, danger is already near. But there is hope. Because unlike many other organs, your blood vessels are highly responsive to change. With the right habits, the right foods, the right routines, you can actually reverse much of this damage. You can restore blood flow. You can reactivate nitric oxide. You can balance testosterone naturally. And yes, you can regain your strength, your confidence, and your connection. The first step? Stop thinking this is just about sex. It's not. It's about survival. The second step? Start learning what your body is telling you. That means listening to the signals, even the ones that feel uncomfortable. If you've noticed reduced firmness, a delay in arousal, or just a sense that something has changed, it's not your imagination. It's your body whispering before it screams. Don't wait until a heart attack or stroke to take action. Use this signal now, while it's still early. In the next section, I'll walk you through the exact health conditions linked to ED and what blood flow failure in the penis is trying to reveal about your heart, brain, and hormones. You'll learn the hidden connections doctors are only now starting to talk about, and what you can do today to turn this warning into a wake-up call that transforms your life. Let's dive deeper into what erectile dysfunction is really telling you about your health. Because it's not just about circulation, it's about the interconnected web of systems that keep your body alive, and what happens when they begin to break down, often starting in the most intimate place. When a man over 60 begins losing firmness, it almost always points to one or more of 4 hidden health issues. And the first one is silent heart disease. Think about this. Your penis requires between 10 and 20 times more blood flow than most other parts of your body when aroused. That means your cardiovascular system needs to respond fast and efficiently. If there's plaque in your arteries, if your heart is struggling to pump, or if your endothelial lining, the tissue that controls blood vessel expansion, is damaged, the result is a soft erection. That's not dysfunction. That's biology warning you. Numerous studies now confirm this. Men with ED have a 40 to 60% higher risk of developing heart disease. And for many of them, ED shows up 3 to 5 years before the first cardiac event. That means your penis could be giving you a multi-year head start to take action, if you're willing to listen. The second silent killer? Type 2 diabetes. This condition damages small blood vessels and nerves, including those in your penis. High blood sugar thickens blood, inflames tissues, and wrecks the fragile systems required for a healthy erection. In fact, nearly 75% of men with diabetes also suffer from ED. And the worst part? Most men don't even know they're pre-diabetic until the symptoms show up in the bedroom. They ignore fatigue, they shrug off sugar cravings, but when intimacy starts to decline, that's often the wake-up call. The third danger? Low testosterone. This hormone isn't just about libido. It supports mood, metabolism, muscle strength, bone density, and even heart health. After age 30, testosterone levels decline by about 1% per year, and by the time you're 60 or 70, that drop can become severe. Low testosterone decreases nitric oxide production, which directly affects blood flow. It also reduces your confidence, your drive, and your ability to recover from stress. And here's what's fascinating. Men who experience ED are nearly 5 times more likely to have low testosterone, and restoring that balance, naturally or medically, can often reverse both symptoms at once. The fourth hidden threat? Early neurodegeneration. That's right, your brain. ED has now been linked to early signs of cognitive decline, including memory loss, reduced focus, and in some cases, increased risk for Alzheimer's and Parkinson's. Why? Because both your brain and your penis rely on the same delicate blood vessels and nerve pathways. When one system starts to break down, the other isn't far behind. So now let me ask you, do you still think this is just about aging? Or are you starting to see the bigger picture? Because here's the truth. Your body isn't betraying you. It's begging you to take action. So what can you do? That's the part I love most. Because despite all the scary truths we've just uncovered, there is so much you can do, starting today, to reverse the decline and restore real health. First, improve your circulation. That means eating more foods that boost nitric oxide and reduce inflammation. Think beets, garlic, spinach, pomegranate, turmeric, ginger, and yes, dark chocolate. Avoid heavy saturated fats, processed sugar, and fried foods that clog arteries and harden blood vessels. Second, move your body. Even a 20-minute walk increases testosterone and blood flow. Resistance training with light weights or body weight squats triggers hormone release and rebuilds vascular flexibility. You don't need a gym, you just need consistency. Third, sleep like it matters. Because it does. Testosterone is produced during deep sleep. Poor rest increases cortisol, the stress hormone that kills your libido and hurts blood vessels. Aim for 7 to 8 hours. Go to bed by 10 if you can. Create a nighttime ritual that supports your recovery. Fourth, boost your testosterone naturally. That includes sunlight in the morning for vitamin D, healthy fats like olive oil and avocados, and reducing alcohol and processed carbs. If your levels are dangerously low, talk to a doctor about safe testosterone support. But for most men, diet, movement, sleep, and stress reduction go a long way. Fifth, start treating your erection not as a luxury, but as a diagnostic tool. Pay attention to morning erections. Are they consistent? Are they strong? If not, that's a valuable signal. Track your progress. When firmness improves, it often means the rest of your body is healing too. Now I want to address the emotional part, because for many men, losing intimacy means more than just a physical change. It brings shame, distance, and even relationship strain. I've counseled countless couples where the woman thought he didn't love her anymore, when really, he was scared, embarrassed, and too proud to talk. They needed to know that what they were going through wasn't failure. It was a signal, a second chance. If that's you or someone you love, I want you to hear this clearly. You are not broken. You are not done. Your body is still capable of healing, but it needs your help. In the next section, I'll walk you through one of the most powerful, research-backed natural techniques for restoring blood flow and reversing early ED without medication. It's a simple practice rooted in ancient medicine and now proven by modern science. And it starts with your fingertips. That's right. We're going to talk about pressure points, acupressure, and how stimulating a very specific spot on your body before bed can support erections, reduce stress, and even help regulate hormones. I'll show you where it is, how to activate it, and why it's become one of my favorite tools for men over 60 who want natural results. This isn't magic. It's medicine that finally respects how your body truly works. So stay with me. You're about to learn something no pill will ever teach you.